Every 20 seconds, someone around the world loses a leg by amputation, usually the result of diabetes, according to Dr. George Andros of Valley Presbyterian Hospital in Van Nuys. Their Amputation Prevention Center features a team of medical specialists devoted entirely to limb-saving procedures.
In our center, if a patient comes in and they've got a sore on their foot, which is usually what happens with a diabetic, it starts with a sore and it doesn't heal, and I need a podiatrist, I go to the door and I say, would you have Dr. Belzic or Dr. Rogers come down the hall? Would you have the vascular tech come over here? We're going to do vascular studies. We need x-rays. We need a diabetic specialist. Would you get the diabetes specialist here? Would you get my infectious disease guy? And they're all there.
Dr. Andros discusses the center's unique qualities.
We have our own vascular lab. We have x-ray. We have specialized diagnostic testing. We have nurses and other specialists who do particular kinds of wound dressings and casts. One stop. But it's focused on the disease in the patient. It's not focused on what we do, it's what they need. It's an approach that's not new for cancer. We all accept it for cancer. And yet if you think about diabetes, diabetes takes way more lives than cancer.
Dr. Andros told us about his medical staff.
Well, we have 2 vascular surgeons. We have full-time. We have 2 full-time diabetic podiatrists. These are podiatrists who have completed their training and then gone on to take specialized training in diabetic podiatry, and then have gone on usually to take additional training after that, and each of them were in practice before they came here. So these are, though they're young, they're highly experienced with a whole variety of specialized techniques that are particularly apropos to diabetic foot problems.
Monitoring the patients is one aspect of care.
We follow our data. We follow every patient completely from beginning to end. Every time you come in, we take a picture of your ulcer. And if it's not getting better, we can check back 6 weeks and say, oh, you are better, take a look, or you're not better, we have to change course here. And now that's pretty unique, and our center is unique. If you take the patients that come into our center, we save 96% of the people who are facing amputation. And if you ask the patient what their chances of saving their leg, the chance is, when they first come in, what is the chance? They say, oh, 95% chance I'm going to lose my leg. And they don't know, it's just the opposite. It's just the opposite. If you bring the important elements to bear, we save 95% of the patients.
Dr. Andros discusses the Amputation Prevention Center's policy.
Our policy is, even if you don't walk in, you're going to walk out. We make demands of our patients. We make a major commitment to these people, and we ask them to commit too. We have, around the corner from our center is our rehabilitation center, and we work closely with them so that just because we fixed their leg doesn't mean they're ready for life. So they go to the rehab center, and I tell them when they come in, you may not walk in, but you're going to walk out. So we have shorter than average hospital stays, amputation prevention, and wound healing. And that's because of the team. That's how we do it. And anybody someone will try and find the secret sauce. No secret sauce. Team, that's the secret sauce. And a team that can work together, and fortunately we've got terrific people. And most of our patients do come from elsewhere, and over half of them have had an attempt at limb salvage before they come. More than half. And most of them come to us saying, well, you're the last resort, I'm going to lose my leg. What do I have to lose? And I tell them, you have your leg to lose and you have a lot to gain.